everybody. Misty here from Healing Rosie, and I'm super excited about the conversation I'm going to have with Susan Bratton today. So you guys know that we are doing this Facebook Live. I've got lots of questions from our community, and there's several reasons why I really wanted to have this conversation with Susan. I am hearing constantly in our community questions from women, not only about the typical health things that you would expect to come up from a community like ours around hormone health or autoimmunity or whatever, but there's been a lot of women who recently have been complaining about pelvic pain and different kinds of pelvic pain. These are the kinds of things that you can go to your doctor and you can, try to get a medical diagnosis for some of what you're dealing with. But this area is really tricky because when we're experiencing pelvic pain, it not only affects our day-to-day if we're experiencing cramping, especially if we have like endometrial pain and stuff like that, where we've got cramping and just daily discomfort, in the pelvic area, but it affects our relationships with our partners. And it even affects our own enjoyment of sex. And I really want to make sure that part of the conversation that we're having here in the Healing Rosie community is not just the medical conversation, but we talk about like the emotional part of what we're experiencing together as women. And it's super important that we get some tools that are going to help us to navigate this area. Our doctors aren't going to give us the tools we need to have really challenging conversations with our partners. Our doctors aren't going to give us the tools that we need to internally make sense of what's happening to us so that we feel peaceful about it and we don't feel a lot of shame or anxiety around what's happening in our bodies. So I love Susan, and you guys probably remember her from the Fix for Female Hormones that we did last fall. But Susan is so amazing about this because she has a compassionate, open, honest, fun way of creating dialogue around these topics. So I'm super excited to dive in. Susan, as you guys know, is not a medical expert. I like to think of her as a sexpert, and many others think of her in the same way, but she has worked in this space for over 10 years, and she is a wealth of knowledge around all of these women's health issues. She's had to navigate this for herself. You may remember that she had to have some procedures done herself to kind of, I don't know if you'd call it reconstruction, Susan, but she's really had to navigate a lot of these challenging situations that we deal with as women. And I love that she comes from a space of knowing and understanding what's happening in our bodies and can talk to us compassionately and openly and give us some really great tools to just deal with all of the pelvic pain stuff that's coming up. So welcome, Susan.
Misty, thank you. Yeah, I had vaginal rejuvenation in my 50s. Yeah, vaginal rejuvenation. And some people get confused about that. They think that that's like labiaplasty, where I'm cutting my labia or something like that. And it's not. What vaginal rejuvenation does, and this might be something that is helpful for a lot of women when you're dealing with pelvic pain. I had pelvic pain. Specifically, I had pain with intercourse right at the entrance to my vagina. There's a sphincter in the opening of your vagina. It's called your introitus, or your introital sphincter. And it's kind of a little rubber band, if you will. And right at the entrance to your vagina, right inside your vagina, can get very sore as you go through menopause because you have a dip in estrogen, and that tissue begins to get much more delicate and thin. And it felt like broken glass inside my vagina when my husband would try to penetrate me. And I tried a lot of hormone replacement therapy, and I tried a lot of lubrication, and it just wasn't enough. I was having a lot of pain. And so what I did was I used a combination or a stack of 3 different modalities, vaginal rejuvenation modalities. The first was a CO2 laser. I've had a lot of Fraxel lasering on my skin, my neck, even my arms. I get age spots. I'm very fair, and the sun just kills my skin. And Fraxel, which is a laser, worked really well on my external skin to kind of bring more collagen and rejuvenate it and get rid of age spots. And I thought, well, lasers seem to work really well on me. I'll try this intravaginal laser. And it's basically just a penis-shaped tube that shoots out little lasers, pew, 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 like that, up in your vagina. And what it does is micro damage the tissue so that it brings healing growth factors from your own body to repair that damage and makes it a little thicker and stronger and fresher and newer. And that was the thing that saved my sex life for my particular issue. We're going to talk about a lot of issues on this Facebook Live, but that one was the one for me. The second thing that I did was purely cosmetic in a way, pleasure/cosmetic, and that was an RF device, so sound healing, that was on my outer labia, and it kind of bites a little bit. It feels like ooh, 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 like that when it goes on the outer labia and the inner labia. But it plumps up that tissue and brings more collagen to that tissue, brings back sensitivity, and makes your labia less droopy. It droops over time and kind of looks like testicles, scrotal tissue down there, which is like, my God, gross, but it happens to us. And so I had that done. And then I had a third procedure done, which was something called the orgasm shot, or O shot, invented by a guy named Dr. Charles Runnels. I've done a complete video interview series with Dr. Runnels on using PRP, or platelet-rich plasma, both for penile tissue regeneration as well as for clitoral tissue regeneration. And in that particular case, what the doctor did was take blood right out of my arm, whole blood, put it in a centrifuge, spin it, pull off the white blood cells, the red blood cells. You're left with this yellow broth that's called a fibrin-rich matrix. It has healing factors from your blood, including cytokines, which call like a dog whistle to your stem cells that are in your adipose tissue and your bone marrow. And it calls them to come in and heal this tissue. And your clitoral tissue is like it's the same tissue as a man has in his penis. It's erectile tissue, which is one of the things we're going to be talking about as we answer some of your followers' questions today. The importance of keeping that erectile tissue to have blood carrying capacity, to have it engorged or swollen or tumescent, because that's actually what helps you reduce pain and create pleasure, is erectile function. And the PRP injected into your clitoral tissue, which sounds like it hurts a lot, but you literally don't even feel it because they put a little lidocaine on there, that brings all the growth factors into that tissue. And it took me 3 O shots before I felt like, the first one I was like, well, I couldn't really tell. Did it really change anything? The second one I was like, oh yeah, that definitely was good. Now I feel like I'm getting sensation back. By the third one I was like, oh my gosh, I am feeling the sensations in my vulva, in my clitoral structure. I'm having orgasms that feel as good as when I was 35. But I have such better orgasms now because you get better at sex as you age, but you lose sensation. So having the O shot was the thing that kind of brought me back to feeling youthful and having more orgasmic capacity. And so that stack of those 3 protocols was fantastic for bringing me back to a level of orgasmic pleasure that I'd never had in my life, because I'd never orgasmed as well as I do now, because you learn it. And I had the sensation of someone 20 or 25 years younger. Mm-hmm. So these kinds of things are only the tip of the iceberg of what can be done to make women feel more pleasure and get rid of pain. And we'll talk about a lot of other kinds of things besides that. But that was my own particular journey. Most recently, in the last, I would say, 2 years, I did that.
Yeah. So when you're talking about these different procedures, are these procedures hundreds of dollars, thousands of dollars, tens of thousands of dollars? Like, where are they?
Probably that whole thing. I probably had 5. I had 3 O shots, 5 lasers, and maybe 4 of the external RF. And it probably, if you added it all up, was about $6,000.
Okay. Just to kind of give people an idea.
Yeah.
Okay, well, this is great. Well, we have lots of questions from the community, and I want to dive in. This is going to be a super candid conversation. I should actually put in the little Facebook Live notes that, audience beware, we are talking about sex. So you don't want to watch. You don't want to watch work when you're going to have coworkers coming in and out. For sure, you will put on your headphones. But let's just dive in here. The first question I have is from Dominica. That's how you say her name. What causes pelvic pain and how do I diagnose it? My problem started with a chlamydia infection. I remember having very bad right side pelvis pain. After antibiotics, the chlamydia was clear, but the pain persisted. Less than a year later, it was discovered that I had an ovarian cyst on the left ovary. The cyst was removed by the laparoscopic surgeon. Pain eased, but still exists and always on the right side. Also, the ovarian dermoid cyst keeps coming back roughly every 2 years, always on the left ovary. I had since had 4 laparoscopies and there was adhesions present each time, even on the very first surgery, so it formed before. Now the pain is stronger. Ultrasound, MRI, and other tests are normal. Endometrius was excluded on laparoscopy and gynecologist says it's a mystery.
Okay. This one's a pretty cut and dried situation. And that is that you're not working with someone who knows what they're doing. I'm sorry, Dominica, but if your gynecologist is telling you it's a mystery, then you need to go to another specialist.
Yeah, that's what for me too.
So I want you to be your own health advocate. And I obviously cannot give you a diagnosis. I haven't seen you, what have you, and I'm not a doctor, but here's the path that I would take. It would be a 3-prong path. The first thing that I would do is I would go to an endocrinologist, not a gynecologist, and within your healthcare system. It sounds like you have healthcare, thank God. So first thing I would do is I'd ask for a referral to an endocrinologist, and I would have a full hormone panel. I would follow Misty's directions for the 4-point dried urine test, the Dutch test, not just blood tests, and I would get a full panel including cortisol, all your adrenals, etc. And I'd look at what is the situation there. I'd also want to ask you, are you on birth control or on a hormonal contraception or taking any kind of non-bioidentical hormones? Because that could be that you have some kind of a hormonal imbalance that's generating these cysts. So that's the first thing that I'd look at. The second thing that I would do, is I would talk to a functional medicine doctor. So what I'm telling you is essentially go with Western allopathic care in your health system. Follow down that path. At the same time, talk to a functional medicine doctor and have them look at your systemic lifestyle, toxic molds, anything that could be a contributor. It could be a familial issue. It could be a gene expression. There's a lot of things that could be researched here. So in addition to just working on the hormone stuff with the standard Western doctor, I'd be talking to a functional medicine doctor. And then the third thing that I would be doing is somehow seeking out some pelvic massage, because you're getting wounding from all these procedures that you're having. They're creating scar tissue and they're in there scraping away at your body. And that's creating both anxiety in your nervous system as well as pain in your body. And you can get abdominal massages. You can find someone in your area that works from the outside and gives you abdominal massages. You can find someone who is a sexual healer and will do internal vaginal work. You can go to a pelvic therapist, a physical therapist who is an expert in women's pelvic healing, and they can do a lot of work inside to rub and move that scar tissue and get blood flow. Blood flow is huge. Then the other thing that you could consider doing is talking to someone who does pelvic PRP as a possibility. If there are specific locations where you're always having pain, there could be something possible to do with PRP. I would explore it as a fourth alternative, but those are the 3 paths I'd take simultaneously. And I would stay on it. I would set a goal for myself within 1 year. I'm going to figure out what the problem is and get myself on a healing path. I'm not going to continue to let this go. because it's very, very important to nip these kinds of things in the bud. You've gone through this a couple times now and there's been no solution to why it's coming back. You've got to push people to get the answers for you and learn how to do it yourself.
Yeah, there's a couple of things that come up for me that I just want to add to this, Dominica. First of all, I hope you've downloaded the Healing Rosie lab tracker, healingrosie.com/lab tracker, and it tells you all the labs that you need to have run. That's going to be really important for you to advocate. Please avail yourself to the support available in our community. When you're working with doctors, if they're blowing you off, if they're telling you it's a mystery, if they're trying to make you seem like you're making something up in your head, you do not need to take that from any doctor. You don't need to let anyone tell you that you're some kind of hypochondriac that's just making things up. So make sure that you get the support you need from the community. And finding a good functional medicine doctor will help, because they'll support you in looking at other options for treatment and care, and even help you know what conversation to have with the endocrinologist. You know, what do you talk to your gynecologist about? So having a good functional medicine doctor can be really helpful. If you go to the Institute of Functional Medicine, ifm.org/find-a-practitioner, you can find a practitioner in your local area. And if you're having trouble finding a good functional medicine practitioner locally, go to steadymd.com/healing Rosie and consider working with an amazing functional medicine doctor online. I love SteadyMD. We've had one of their doctors come and do an Ask Me Anything with our community. We have another one coming up soon. But I think that's another really great alternative for you. So there's so much help available. We've got lots of resources in the group. And yeah, great advice, Susan. Thank you for that. Alrighty, next question is from Diana. After sex, my pelvis hurts. I no longer have a uterus. Could this be the reason? Perhaps it's scar tissue from endometriosis?
Yeah, so when people say after sex, I have to assume they mean penetrative intercourse. And part of the pain could be from the penis in your vagina, kind of poking up in there. If your partner's penis is a little bit too big for you, which happens for a fair number of women, there is a product called the O-Nut, O-H-N-U-T, and it's like a bumper cushion that he slides onto his penis so that he still gets maximum pleasure, but you don't have to have all of his penis inside you. So that's something that, if that is an issue, you might look at. The second thing that might be causing you pain is the orgasmic contraction. And that is something where I want to talk to you about how you orgasm. There are a lot of women for whom they crunch and bear down, you know, to like, oh, I'm so close, oh, you know, really trying to have that orgasm. And that's creating a lot of tension in your body. And that tension could be interacting with the scar tissue or the wounding that has happened in the past to you. There can also be a lot of anxiety around intercourse because you are afraid that it's going to hurt. And so there are a couple of things I want to tell you about orgasm. The first one is that instead of crunching down or concentrating or focusing, try and open, try and breathe into your pelvis, breathe into your yoni. Your yoni is another word for your vulva, which is the politically correct term for vagina, because a vagina is just the chute, the sleeve, the glove, the intercave, where your vulva is actually all of your labia majora, labia minora, the clitoral structure, the hood, the mons, all of that, the perineum, that whole area up inside, that's your vulva. So there are a lot of people who think that vagina is like a white male patriarchy oriented thing, like, oh, that's all they care about is that one part of me. Let's talk about all these parts of me, which is why I wanted to bring that up, which is that when you make love with your partner, have them start by giving you a 15-minute full attention on your yoni genital massage. Starting at the outside, your legs, your belly, your mons, your sweet little butt cheeks, using organic coconut oil or sweet almond oil, and then slowly moving in and thinking about having your partner bring blood into all that tissue. Blood flow is the queen of sex, as it is the king of sex for men. And must have your partner massage the outer labia by kneading it like a kitty cat, rubbing it between his fingers, stroking the inner labia very delicately with lots of lube on his hands. If your partner is male-bodied and has super rough hands, have him put on latex-free, very tight gloves first, because then it's very slidey and there's no friction on the labial tissue. Have him rub your mons and really get that almost gelatinous. You'll find as you start out with yoni massage that your mons and your outer labia, which underneath that are your vestibular bulbs, which are the legs of your clitoris, are right underneath there. They like pressure, just like your G-spot does. Your mons likes to be smoothed and rubbed smooth, and that tissue will actually get like jelly. It'll get real loose, which, by the way, is a real trick if you also are someone who's interested in ejaculation, female ejaculation. That's one of the tricks, is having a lot of ability for the fluid to come down into your yoni by having all that tissue really liquidy. And then have him start stroking your clitoral hood, and then down and up the inside, but not entering you, and then stroking your clitoris in very light strokes, circles, and rainbow arcs across your clitoris. And then slowly, as you invite him, taking time and not asking for this until you're ready and want it, having him lubricate again his hands and enter you slowly and rub the roof, the cave of your vagina, the sides of your vagina have nerves that run down them that will relax you. The base, the floor of your vagina, there's a sponge at the top, that's your G-spot. There's a sponge at the bottom, that's your perineal sponge. They're both erectile tissue. So by rubbing all of that, as well as underneath the labia, you're engorging, bringing blood flow into your entire genital system. That's both going to lower your anxiety and relax you. And it takes practice. You'll literally get good at this after 5 or 10 times with your partner. They don't know what they're doing. They haven't felt all of this tissue before. You've got to learn how to relax and receive, calm your nervous system down. And once you start to get all that genital engorgement, it's just going to completely relieve the feelings of pressure that you're putting on yourself. And then when you're ready, maybe if you can have oral sex, that also then is kind of a next phase of bringing more blood in. If your partner likes to go down on you, that can be really nice. And then you're still very relaxed. Get yourself in a comfortable position where you're supported by pillows, your legs are relaxed, you're up on a pillow so your partner can give you cunnilingus in a more comfortable fashion for their neck. And I want you to start breathing very deeply. I want you to really I want you to be doing that in a rhythm that feels good to your body, where you're breathing all the way down into your clitoral tissue, all the way down into your vagina, all the way down into the fear of being hurt, and you're opening that. And I don't want you to worry about having any orgasms at all. I want you to not try to have orgasms. I want orgasms to bubble up out of you. I want you to just be the queen of relaxation and pleasure. And as your partner is giving you all of this loving attention, I want you to just be telling them how much you love them, how much you appreciate them, how much you're a lucky woman to have such a doting and loving partner who's going to help you overcome the anxiety, the fear, and the pain, so that you can get back to the loving connection of passion that you have with your partner, so that the world can fall away and the orgasms can just come up out of you.
Mm-hmm.
That's a good journey for you. It could take you the rest of your life to get there, but I guarantee you that the orgasms you have from that kind of lovemaking, that slow, connected, healing, nurturing sex, may be just enough that there isn't even anything else that you have to do. But that being said, wherever it hurts, have your partner rub and give them direction about exactly what feels good. Have them go in from the top, have them grow in from inside. Teach them how to relax and relieve the pain. Identify where it's coming from. Keep a log as to when it happens. What did you do that stopped it? When did it start? And then you can take the next step in potentially figuring out if there's something continually going wrong inside with your doctor.
Mm-hmm. One of the things that's coming up for me as I'm listening to you talk about this is I'm not sure that as women, we necessarily have the tools to really have this kind of conversation with our partners. And I know that you have this awesome guide called the Sexual Soulmate Pact that, will go over several bedroom communication techniques. And I'm going to make sure that I include the link here for everyone in the status so that you guys can go download this. But can you kind of give us a sneak peek? Like, how would Diana go about opening up this conversation with her man?
Yeah. Here's something that I want to tell you. 90% of men, now I've worked with men for over a decade, men and their sexuality and their relationship with their women is my expertise. I know what those guys are thinking. This is what I know. And 95% of men would do anything for their woman to be sexually satisfied and feel happy and connected. Men really care. If they're not doing something that you want them to do, it's literally because they don't know. They don't get any sex education. Nobody tells them anything. They're at a loss. They're just making stuff up. They maybe see things they see on porn, unfortunately, which aren't often the way we want to be touched and loved by women. So opening up a really good communication channel with your partner in an area where often we feel embarrassed to talk about sex is it will open up a level of intimacy in your love life that's incredible. I have a book called Sexual Soulmates, The 6 Essentials to Connected Sex. And I took a decade of I'm kind of like a Dear Abby of sex. I give sex advice. That's what I do. I learn about passionate lovemaking techniques, advanced orgasm skills, bedroom communication skills, and sexual health protocols. And that's what I teach people. Very practical stuff. And in my book, Sexual Soulmates, one of the 6 essentials, the one that I think is probably the crusher, the one, if you were only going to learn one sex technique from me in the universe, what would it be? It's the Sexual Soulmate Pact. And as Misty said, we're going to give that to you. That's an excerpt from my book. We're going to give that technique to you. And I've written it such that I've actually kind of written it for men, because often it's the woman who can encourage the man to have more sexual conversations. Once she opens up the lines, he's willing to have the talk. But here's what he doesn't understand. So when you download this and you read this, it will really help you have the conversation with your male-bodied partner about how to open up the lines of conversation in the bedroom. And the way that it works is the following. There's 2 pieces to it. One piece is, and the reason I call it a pact, is that it's an agreement between the 2 of you that you're going to be more communicative. So it's your pact, your bedroom pact. The second thing is that because men are a little more steady state and less cyclical by the moon from a hormonal perspective, what feels good to them today probably feels just as good to them tomorrow. They enjoy a wide variety of sexual pleasure, but they're also happy if every day they could have sex, they would just be super happy. Where for women, we rise and fall with the moon in our flow. And so some days we like things very, very, very soft and delicate, and we want to be really held. And other times we want to be ravished and thrown on the bed and made love to. And so we run this wide range, and the guys have no idea what we want what day. And so this is a way that you can talk to them and explain to them. And here's how I explain it. I call it reporting in from your animal. And that is essentially that you explain to your guy, look, you know how you can never quite figure me out and like what worked yesterday didn't work today? Well, I'm going to start cluing you in and letting you know when I need lighter touch, heavier touch, more pressure, less pressure, faster, slower, take a break, whatever it might be. I'm to move down, go up. Can you play with my nipples at the same time? Will you kiss my neck right here? Can you stroke my hair? Will you kiss my eyelids? Rub my belly? Can you rub my feet first because they hurt and there's no way I could have sex if my feet hurt? I've got a crick in my neck. Can you rub my hand? Like, there's a never-ending, list of stuff we want as far as touch and love and kissing and things like that. Go shave before you kiss me. So once you start to give them the answers, and here's the trick, this is what they need to do. You say to them, I'm going to tell you everything because I have no control over this body that I live in. She wants what she wants. Sometimes she's a kitty cat, sometimes she's a tiger. And so let's be on the same team and just give kitty cat what she needs in the moment. That way you'll win, I'll win, we'll win together. And here's the thing, sweetie, this is what I really need you to do for me, because if I ask you to do something harder, lighter, faster, slower, up here, down there, and you go, I know, or, I know what I'm doing, or you resist my communication, you've made it unsafe for me to tell you what I want. You've shut me down, and then I don't tell you, and then you're not good in bed with me, and then I don't want to have sex with you anymore. So let's reverse that by doing the following for me. When I give you any kind of feedback, if all you do is just say, thank you, baby. God, babes, how's this now? When you just acknowledge me and you're a yes to everything I tell you, and you don't take it personally, because how could you know? I don't know. I'm reporting in from my animal in the moment about what she wants. There's no way you could know. There's no way you could know, dude. So let me tell you, I'll tell you what she wants. We're in this together. It's kind of like us against her in some ways. We're going to trick her. And every time I tell you something, if you just acknowledge and appreciate that feedback, that's going to encourage me to give you more feedback. And that's going to make you a better lover. And then I'm going to want you more for sex. And we're going to have a great sex life together. And that's going to help work around when it hurts when you do this, or when I need more massaging to warm up, or whatever I might need in that day to work around whatever my issues were. Like when I had my sphincter pain, I would say to my husband, I just can't do it anymore. We have to stop. If he didn't have his, his climax, he was like, okay, babe, that's all right. I can take care of myself. I was just glad to be with you for the time that I was with you until we solved the problem. So if you're both solving the problems to get yourself to good wholeness and health, at the same time, you're communicating what hurts, what you have to work around, how you have to compromise. Look, sex isn't all about intercourse. Sex is about oral. It's about dressing up sexy. It's about having fun times. It's about giving him a hand job. It's about all kinds of things. It's kissing. It's sliding your bodies together. You got to work with what you have, work around the problems, and communicate together. And if he understands that acknowledging positively, if it's not failure, it's just feedback. If he's hungry for you to tell him what you want, because when you do, he becomes this incredible lover, then everybody wins.
Mm-hmm. Do you think, Susan, in your experience with a lot of the issues that you had, if you would have had more estrogen support, that it could have prevented things from deteriorating like they did? No, it's just. I was
on estrogen for many, many years, and progesterone, and then I added testosterone. I even tried oxytocin in a cream in my vagina. I tried DHEA creams. I tried all kinds of lubes. My estrogen levels were excellent, and it still wasn't fixing things. Mm-hmm. So I think when you get old, your tissues get thin, and sometimes they just need more help than even hormone replacement can do.
Yeah. I mean, I have a lot of girlfriends that have had the thinning of the tissue as they're going through menopause and on the other side of menopause. I know this is super common for us as women to deal with this. So. Okay, let's jump to the next question. This is also from Diana. Will I ever be able to go off hormones since my hysterectomy? I worry about horrible dryness, which I no longer have since receiving hormone pellets.
Well, first of all, I would encourage Diana to learn more about bioidentical hormone replacement. Pellets are a synthetic hormone. And I don't think, in my personal opinion, and again, I'm not a doctor, it would not be my choice. So
BioT is a pellet that is bioidentical, and I'm not sure which one she's on. BioT is a bioidentical version. So I know they have both. So I'm not sure which one she's on.
I would definitely look into bioidentical hormone replacement. There are lots of people who stay on it for the rest of their lives, women who stay on hormone replacement until the day they die. That's the kind of thing where you have to talk to a doctor, but I think a functional medicine doctor is a good choice for the conversation around sustained hormone replacement.
Mm-hmm. Okay. All right. The next question is from Venetia. I believe after penetration by anything, it started after the gynecologist insisted on doing a LEEP, L-E-E-P, when I had my tubes tied back in 2012. I don't believe it's because of the tubal. She doesn't believe that the bleeding is because of the tubal. Could there be residual damage from the LEEP?
It sounds to me like there is. First of all, I don't know how vigorous the penetration is. I don't know if you're using lubrication. I recommend organic coconut oil, organic avocado oil, organic sweet almond oil instead of chemical lubricants. But you can't, if you're using a condom, you have to use a polypropylene condom, a non-latex polypropylene condom with oils, but that's a very good combination. If your partner, again, is too long and is hitting up against your cervix, because the LEEP is a cervical scrape and kind of an ablative process, there could be some scar tissue. I would definitely go back to my gynecologist and talk to them about this, have them look at the tissue in your cervix, see what's going on there. There's so much here that I can't answer, and there's so little information for me to go on, that the only thing I can tell you is you've got to go get that taken care of. You can't be bleeding from sex every time you have sex. Something has to change. You've got to figure it out.
Mm-hmm. And this is another one, just like the advice you gave initially, Susan, you've got to find the right care providers that are really going to help you work through this. And you deserve it. This is one of the things too, it's really interesting as women. I almost think that we, just generally speaking, think of sex as a luxury and not a need. And so there's this story in our heads that that this isn't something that we can expect our doctors to help us with, because it's not a necessity, like your liver is a necessity, and that's a very unfair, like not realistic perspective to have about sex. There are so many health benefits from sex. There's so many ways that we're supported as women, emotionally and physically, by having a really great sex life. It's important to our overall well-being. And I just want to create space here to give all of us as women the permission to care about this and expect other people to care about it on our behalf if they're entrusted with our healthcare. So, okay. Next question is from Suzanne. What can be the cause of pelvic pain aside from scar tissue, endometriosis, or interstitial cystitis?
One of the most common reasons that women have pelvic pain is pelvic tightness. We hear a lot about do your Kegels, tighten your vagina, tone, all of those kinds of things. But interestingly enough, more women have pelvic tightness than looseness as a reason for painful intercourse. So pelvic physical therapists, there's a ton of them out there. They know all about all of the musculature that holds in all of it holds in all your sex organs and all of your organs in the base of your pelvis. And they can really work with nerve damage, tissue damage, tightness, musculature issues, trauma from childbirth, which is huge, trauma from horseback riding, that's a big one for women. Women, we love to ride our horses and we get hurt. Falls and injuries as children on bike bars and all kinds of things. So it could be any number of things, but a pelvic physical therapist is the way to start to figure it out.
Mm-hmm. So if someone wanted to see a pelvic physical therapist, would they just ask for a referral from their primary care doc?
Yeah. Yeah, just Google who you want and ask for a referral.
Okay, yeah. Awesome. Alrighty. Mishan said, what's the science behind why there's pain during intercourse, or the explanation? I find myself turned on for a few minutes and I think about the pain I'll feel if we have sex and I'm immediately turned off. Any advice? I was diagnosed with endometriosis last week, so I'm new to researching everything.
Okay, well, we've really answered this question in a lot of different ways. Number one, it's be your advocate. It seems like, it's be your advocate, get a good doctor, figure out what's causing the endometriosis, correct that situation, do what you can there, do the relaxation, potentially you need pelvic therapy. It's all of those things. Now you've gotten a lot of directions you can go. The first is being your own advocate.
Yeah, and she's saying here too that she's finding herself turned on for a few minutes, then thinks about the pain and is immediately turned off. This, like, what comes up for me when I hear that is you need to get this figured out quickly. You don't need to like ingrain in your nervous system this negative relationship with sex. And if you don't, you're gonna be programming your body basically to not enjoy sex at all. And so it's really important that you go and start working on this, working on getting it handled. So
yeah.
alrighty. Go ahead.
Yeah. That I was just going to say that is the answer. Is there is no one answer. It's a step-by-step process of figuring out how to solve your pain.
Yeah. Awesome. Well, this has been amazing. I'm so grateful that you squeezed us in. So you guys, Susan is in Australia right now on an extended vacation with her family. And I'm so grateful that you carved out a little bit of time for us. I know we have quite the time difference going on right now. We're actually, even though it's Facebook Live, we're actually pre-recording because we couldn't get the time zone thing to work out properly. So thanks for squeezing us in on your vacation. And you guys download the Sexual Soulmate Pact. There is so much great information in here that's going to support you in having a better relationship with your partner around all of this pelvic health stuff that's coming up for us as we get older. I'm also, if you're on the email list, I'm also going to send out an email with a link to it. There's a link up in the status. So you can download that. And if you have any other questions for Susan, anything else comes up, let us know. And I'll make sure that I feed those over to Susan and get you guys some good support to make sure that you're able to kind of find your breakthrough in this area and also get a lot of help. Susan has so much great information around this. Like, her YouTube channel is hours and hours and hours and hours of like unbelievable education around all of this stuff. And I want the women in our community to be supported sexually and emotionally as well as physically when it comes to a lot of the issues that we're dealing with. And I really appreciate you coming in, Susan, and having this conversation with us and opening up an area that can sometimes be kind of tricky to talk about. But I know it's one that I want to support my sisters in finding some answers and breakthrough in. And you're so great about sharing. So thank you so much.
Thank you.
All right. We'll see you guys later.